before we go live? Any? Yeah. A very warm welcome, everyone. I, Dr. Nishant Sharma, Senior Manager, on behalf of Voice of Healthcare, thank you all for joining us today. Welcome to our new series of broadcasts, Emerging Trends in Medical Tourism. In this series, we aim to pick brains of some of the finest industry leaders we have in the medical tourism segment. We will discuss about the need for medical value travel, its scope of expansion, and also shed some light on the upcoming and the latest trends that we are seeing in this ever-evolving healthcare space. Some facts and figures: the Indian medical tourism industry to this date is around 6 billion USD and is forecasted to grow by 11% CAGR. With this series, we aim to answer some of the most sought after questions that we have in the MVT space, what emerging technological trends we are seeing, and how is it becoming an essential part of the Indian healthcare market. With this, I'd like to welcome our guest speaker, Mr. Pankaj Chandna, who is co-founder at Vaidam.com, one of the India's leading medical tourism companies. Good evening, Mr. Pankaj. I welcome you. Please have a few
Thank you,
words
Dr.
of yourself.
Nishant. Thank you,
Yes.
Dr. Nishant. Thank you for this opportunity. And I'm happy to be here on this platform, and I wish you and the Voice of Healthcare all the very best for this series. So a quick introduction. So my name is Pankaj Chandna. I am co-founder for Vaidam Health, and we are a 7.5-year-old, one of the largest medical travel platform, not just in India, worldwide, I should say. As we move along, I will tell you that how at Vaidam we not only handle or receive patients in India, but about 8 different destinations in the world. Sitting here in Gurgaon, New Delhi, India, we have been able to send patients to Germany and Thailand and Malaysia and Turkey and some of these destinations as well.
I think it's all about the patient expertise and the caring that you guys have been showing, which is really empathetic. So I think we can start the questions for the day. I hope you're ready. The questions, for the discussion.
Yes,
So to
yes,
start with,
I'm ready.
one refresher for all our viewers and the audience. What exactly is MVT, and what do you think is the need for it?
Okay, so before starting this company, I never thought that the country that we are born in, we are privileged that we have healthcare available to us. We never thought about it. We all take healthcare for granted. And after starting this business and after having traveled to 30 countries by now in different parts of the world, I realize how fortunate we are that whenever someone of our loved ones, friends, and family falls sick, we don't have to leave our country. Unfortunately, that is the scenario in many countries world over. Wherever, when someone falls sick, unfortunately there is either no doctors available, there is no healthcare available, or the expertise is completely missing. So when
Right.
someone, for example, for that matter, almost entire Africa, leaving 3 or 4 countries aside, there are 54 countries in African continent. I think about 48 to 50 of them lack even a basic tertiary care healthcare. So yes, of course, for ops and gynae, kids are being born there, basic primary healthcare is available. But whenever someone has to go any major tertiary care surgeries, be it orthopedic or cancer treatment or any organ transplant, unfortunately that thing is completely unavailable. So those patients, whenever someone falls sick, unfortunately they have no other option but to look outside their country of residence. And
Correct.
that was the reason of existence of this industry. Medical value travel, when we say, it means that someone is traveling to fulfill their medical needs, and that there is a value that they derive out of it. It could be cheaper healthcare, it could be better healthcare, it could be so different. Patients from different countries have different reasons to travel. Someone is traveling because there is no healthcare available in the country. Someone is traveling because unfortunately they can't trust the doctors because they have very limited expertise in handling similar cases. Or maybe they are born in a country where if you don't have an insurance, the cost of medical care is exorbitant and you just can't afford it. Or there
Right.
could be another scenario where you have healthcare, you have good doctors, and because it's government state sponsored, it's free of cost. So there are long queues to access that healthcare.
Right.
And if someone does not want to wait, so they decide to spend the money out of pocket, and those are the main drivers while someone decides to travel. And those are the needs that we fulfill at Vaidam for patients who are looking for treatment outside their country of residence.
Right. I think the crux of all of this is making healthcare more accessible to that part of the world where tertiary care, or let's say primary or secondary care, is not on the grim of what they really require. Yes, sir. So
So about
yeah.
80% of the patients, as you rightly said, about 80% of the patients who come, especially to country like India, are coming because of the unavailability or lack of quality healthcare. There are only about 20% who travel from leading countries like USA, Canada, Australia, New Zealand, or Europe. Although the
Mhm.
healthcare was available, but they have different reasons to travel. But yes, what you said, 80% are traveling for basic accessibility of healthcare.
Yes, and I think more value is added for those patients where the countries are not really having the top level of healthcare. I mean, for the rest of the patients traveling from first world countries to other countries is majorly for cost benefit analysis that they are trying to portray. I
Correct.
see, sir. Yes, sir. So moving on to the next question. What are the most trusted global destinations for medical travelers, apart from India and including India as well?
Okay, so there are mainly three major world players in this industry,
Hmm.
and that goes by Thailand, Turkey, and India. Those three are global players, and they get patients from more than 100 countries each.
I
Patients
see.
travel from more than 100 countries to one of these three destinations for treatment. And then there is a next line of layer, which is Singapore, then there is South Korea, there is Malaysia. If we go east, there is Israel. People from or patients from United States even travel to
Mhm.
Mexico. So in total, there are about 15 to 18 places where patients travel for medical needs. But as I said, there
Mhm.
are top three where when someone receives patients from more than 100 countries, and thankfully India features in one of those three.
Right. Any particular reason that India and along with Thailand and Turkey are leading this medical hotspots, the global hotspots? Any particular reason?
So I think I can tell for each of these. So well, let's talk about India first. So India,
Mhm.
the main region of patients coming is very affordable medical care. And if you notice that most of our patients who travel to India are our neighbors. It could be Bangladesh or Iraq, or before Taliban, it was Afghanistan. And then the next wave of patients travel from Africa or Middle Eastern countries. So most of
Mhm.
these patients travel because, unfortunately, they are sick, the healthcare is not available, and they cannot afford medical treatment in any of the other major destinations. That does not mean that our healthcare is just a cheap, and there is no quality in it. Thankfully, we fulfill both the criteria. We offer amazingly top quality, which you can easily compare with any developed first nation world at a
Mhm.
very affordable cost. So it's a double benefit for any of the patients who are coming to India, that they get top quality at a very reasonable cost. In fact, so much so sometimes patients can't even believe that a treatment is available at such a price unless they come and see for themselves.
Right, right. I see. And moving on to the next two players that you mentioned, Turkey and Thailand. I have also been reading about it. Turkey is emerging as one of the finest destinations now. Has
Yeah.
improved its healthcare. And so, do you think the embassies do happen to have a lot of role to play in making a medical tourism hotspot for medical travelers? Do you feel so?
So yes. So first thing is that to develop any medical travel destination, the government, the push from the state machinery is very important. See, any
Okay.
hospital, be it in India, be it in Turkey or Thailand, they can only
Hmm.
promote their brand. But to sell any country as a destination is beyond their means and resources. That's where we
Mhm.
need the push from the top government officials to sell, for example, India as a destination, or to sell Thailand as a destination, or to sell
Mhm.
Turkey as a destination. Those are the government job, and they do it. The Ministry of Health and Ministry of Commerce, they all have this as part of their agendas and activities to promote
Mhm.
India for tourism, for medical travel, or for many reasons. So yes,
Mhm.
while India is doing to promote India as a destination, same ways the top officials or the government officials of Turkey are promoting Turkey as a destination. They don't talk about any hospital brand. They don't talk about
Mhm.
any particular doctor or specialty. They say, come to Turkey for treatment, come to India for healthcare, come to Thailand. So those are definitely, there is a role of the entire government machinery into this program.
I see. Now, moving over to India, what do you think? How well has India emerged as an MVT hotspot in the recent years? And I'd like you to shed some light on how long has it been that India is emerging out, and what do you feel? How well has India emerged?
Well, so as I said, thankfully, we are already among the top three players when it comes to medical travel. Let me give you some perspective in the type of treatments for which patients come to India, which is
Hmm.
very different when it comes to Turkey. So, Turkey gets almost 50 to 70% of their audience who are coming for cosmetics and healthcare. I mean, basic cosmetics and aesthetics procedures. But when it comes to India, most of our patients who travel to us are looking for serious medical care. It could be cancer care or spine surgery or any brain related or cardiac, things which are really medical and life threatening in nature, it could be. But when it
Hmm.
comes to Turkey, their main audience is traveling from Europe, Eastern Europe countries, and Turkic nations, CIS, the Russian speaking part of the world. And almost 50 to 70% of them are traveling for cosmetic procedures. You should know Turkey is called as the hair transplant capital of the world. They do
Okay.
almost a million hair transplants in a year. Just 1 million people doing hair transplant in Turkey every year. And those kind of audience don't think of India as an option, or for that matter,
Hmm.
even Thailand as an option.
Hmm.
Just because Turkey is located at a very strategic place, they are very well connected with Europe, hardly 2 to 3 hours of flight, very
Hmm.
affordable flight cost. Same, they are the connectivity on the Russian speaking CIS countries and the Northern Africa as well.
Right. So I think elective and non-elective surgeries is what you have kind of mentioned, that why people choose Turkey and why people have been choosing India is what I see. So when we talk about more elective and more serious surgeries, do you think India is one of the top priorities for them in terms of quality as well as the amount of money that they will be spending?
That's true. So again, we have to look at which country people travel where. So for example,
Hmm.
when someone in, for example, Myanmar falls sick, the
Hmm.
first name that they have in their mind is Thailand, right? But for
Okay.
that matter, when someone in Uzbekistan or when someone in Iraq falls sick, probably India is the first name that comes to their mind. So yes,
Hmm.
India definitely offers affordable and quality medical care, but it also depends on which source market are we talking. So
Right.
there are some countries where people travel to different places from one country. Like a very good example is Bangladesh.
Okay.
Bangladeshi travel to Thailand in huge numbers, and they travel to
Hmm.
India also in huge numbers. Then,
Hmm.
we take an example of an African country, Ethiopia, where patients
Hmm.
travel to Thailand and Turkey and even India. So the patients from those countries, they know all the three major destinations. So
Hmm.
that's how, Thailand is equally well known for even elective or, so to say, life-threatening medical conditions. Where Thailand
Hmm.
is not just a cosmetic,
Capital.
procedures country. So they do
Hmm.
offer very good quality medical care, just that they are expensive sometimes at almost the double the cost what India can offer.
Right. So talking about India, getting into more depth, what do you think are the cities in India that are the most emerging hotspots, most sought after for the travelers out to India?
Okay, so I will give you some perspective on that. There are mostly six cities where almost I would say 80 to 90% of the medical tourism or medical travelers would go to.
Hmm.
Delhi, Chennai, Bangalore, Mumbai, Hyderabad, and Kolkata. Now,
Okay.
again, you can imagine that Bangladesh being closer to Kolkata, lot of patients, and there is connectivity even by trains. People go there. A lot of patients from Islamic countries or Arabic countries, they prefer going to Hyderabad. So patients from Somalia, Sudan, even Oman for that matter, they all love going to Hyderabad for treatment. Chennai is also very, very popular among Bangladeshis, Omanis, and even patients from Maldives. All of these patients are going to Chennai. So each city has their audience. When it comes
Right.
to Delhi, thankfully, Delhi gets a lot of their patients from Iraq and Uzbekistan. Again, because of the direct flight connectivity, the proximity to some of these nations. So many factors come into play.
I think language barrier is one of the primary factors that kind of they have to discuss that Bangladeshis would prefer Kolkata as well as CIS countries might prefer the southern parts of India.
Well, yes, but thankfully our language capabilities are very evolved now. Like, in our own company, we are now about 100 employees and we can speak 10 international languages. Our team, we can speak Bangla, Russian, Portuguese, Spanish, Uzbek, Romanian, many languages for any international traveler, we can cover that. And thankfully, because of our population, finding interpreter for almost any of the language is not a problem, right? There are patients who travel with from Arabic speaking countries or
Right.
Russian speaking, so we have interpreters available in very good numbers. And since this industry is not a new phenomena, it's not like this is happening for 2 3 5 years. This
Right.
almost Apollo Indraprastha has been doing this for almost 30 years now.
Right. Right. So building on what you said, how do you feel is Vedam changing the game in MVT segment? I mean, I'd like to understand some more facts and pointers from you about Vedam.
Okay, so few things where we are different from rest of our industry mate. The first thing is we are, I mean, I would not say we are the pioneers or we are the first one. There were a few companies who were doing business through digital channels before we started, but fortunately we are the leading one now. And being digital gives us a lot of flexibility that we don't have to be physically present everywhere. Like if I give you an example, we have received patients from 125 plus countries. I don't think any of our competitors can quote that number because we don't have to have an office in each of the countries. We don't even have to have a representative. We just need to get our online traffic. We need to have someone who can speak their language. As long as we are able to communicate, we are able to fulfill the needs of those patients. So that's number one, where being digital and our presence or our reach has given us, we have handled patients from all the 6 continents: North America, South America, Europe, Africa, Asia, Australia. I mean, I don't think we have received anyone from Antarctica or could be receiving anytime soon, but,
Right.
but we have covered almost the rest of the world.
So I think it's about the digital presence. It's about the connectivity that you build, which doesn't necessarily require any. So building on this, I mean, this would be one of my last questions here. What do you think are the emerging changes in technology that is going to bring the increasing scope of MVT, not just in India, but for the MVT segment all globally? What do you think are the emerging technological trends? To start with, I can give you like telemedicine has improved a lot after COVID, as we have seen. So I'd like for you to shed some light on telemedicine as well as the other technological emerging trends that you feel are changing the game.
Yes, so I think I would say almost 80 to 90% of international business can be very well solved with offering high quality telemedicine services.
Okay.
Sometimes even bringing a doctor in front of the patient, like how you and I are communicating over a video call,
Right.
even this much gives a huge confidence to the patient that I have spoken to the doctor, he understood me, I understood what he wants to do, I understand the risk, I understand my post surgery life. These itself takes away a lot of apprehensions in the away from the minds of the patient. And many a times when we offer such telemedicine services, we even involve a doctor on the other side. Like for example, sometimes patient to doctor talk can be garbled. What patient is saying in 15 minutes, the doctor on the other side can summarize it in 30 seconds, that this is what patient is suffering from, or this is what we have been able to diagnose. And then if any further investigations are needed, any further tests are needed, the doctor from here in India can advise the patient or the local doctor to get it done and share the reports. So an appropriate line of treatment can be suggested. Please understand, when any patient decides to travel, the cost of treatment is a very important factor. I mean, it's not like someone can just buy a ticket and travel and see, okay, I would pay whatever it has to. When you have making a plan for international travel, you need to plan yourself. You need to budget your travel. You need to know how much you need to carry to make the treatment or the procedure successfully. And for a doctor to come to that level, for any healthcare professional to arrive at a proper line of treatment and give a cost estimate, they need to have all the relevant information with them. What is the history of the patient? What is the local diagnosis? What kind of investigations he has done? What is the patient likelihood going to get once they arrive? So all this information, when shared with the patient in a comprehensive manner, that gives confidence to the patient as well as to the doctor. Because when a patient travels and doctor sees and says, unfortunately, I can't offer much, it is disheartening for both. I mean, patient traveled for no reason, and doctor also felt sorry that you traveled someone for 24 hours just to make them hear that unfortunately there is nothing much we can do for you.
So I think in places like these is where companies like such as yourself come into play. I think
Yes, of course.
getting that line of treatment from the doctor and moderating the entire and facilitating the entire journey for the patient is, I think, what basically adds value to your patients during your
That's
operations.
right. That's right.
Right, sir.
And
So one,
also, when
yeah,
someone,
please.
just give you a perspective, not just the apprehensions before travel. When a patient is here, obviously they also need a lot of hand holding and support. They are coming to a foreign land. Maybe they don't speak the local language. As I said, we have people who can speak 10 different languages. Someone speaking French comes to India, and when they see someone at airport to receive them speaking French, taking them to the hospital, helping them with the admission process or consultation or investigation, it's a huge relief that someone took care of them for the entire process. And please understand, this is not a happy journey. This is not a happy situation, because they are going through mental trauma. They have emotions. Maybe someone is traveling with their wife or kids or parents. We don't know what their personal story is. So someone helping them, hand holding them at that time, it goes a long way.
Right. So I think it's the empathetic hand holding and the caring for making the quality healthcare more accessible is what is booming this MVT segment for India.
That's
So I
right.
think a bonus question for all of our viewers: how do you think AI can be integrated into MVT? I mean, do you have any thoughts on the top of your head?
I think maybe not so much for an MVT standpoint, but yes, in terms of healthcare, for a better diagnosis, like we keep hearing news about how AI can do a better analysis or a better diagnosis on an MRI report, even sometimes better than a doctor. So yes, those things are going to help patients in general. This is not just about MVT or international patient. This will help you and I or any of our loved ones whenever we need, to access healthcare. So yes, the advancements in technology, the newer things made available will make healthcare more safer, more affordable. As we all know, whatever be the country, be it India or be it United States, most of the countries are struggling to find or match the number of doctors with the number of patients. However
Correct.
much we will add new colleges, we are still not able to match the demand of the healthcare. So many people and falling sick and looking to access healthcare, and the number of doctors are not able to catch up. So such efficiency gain, such increase of better diagnosis at such level will definitely change the game.
Right, sir. Lovely picking your brain, obviously. So with this, I'd like to end our Q&A session. I'd firstly like to thank you, Mr. Pankaj. Thank you for sparing your precious time speaking with us on this
My
hot
pleasure.
and very fresh topic, keeping our audience engaged. Secondly, I'd like to thank all our viewers for watching this and engaging with Voice of Healthcare. So a couple of closing remarks from you, Mr. Pankaj, and then we'll just go offline.
No, well, again, my thanks to you, Dr. Nishant. And like, we have been talking, so I already gave a perspective at Vaidam. We are helping patients go to multiple destinations, and India is not just the option. And as I said, we have received patients from 125 countries. We have just very recently touched 100 employees at Vaidam. And for the last 7.5 years, it's a very fortunate and a very fulfilling journey, I should say, starting a business and being able to help so many patients world over who will remember us, who will thank us in whatever way we would able to add to their life. I think God has given us that opportunity, so we thank Him and we thank everyone who has been part of this journey.
Lovely, sir. We salute your dedication that you're making healthcare more and more accessible for patients, not just in India but globally. So I'd like to thank all our viewers. Thank you, and stay tuned for more Q&A rounds on medical tourism as we continue to engage with more and more industry leaders in the upcoming sessions. I thank you all. I thank you, Mr. Pankaj.
Thank you.
Thank
Take
you.
care.
Take care, sir.